How does HPV affect pap smear results? Imagine getting a pap smear and wondering what it all means. Human papillomavirus, or HPV, is actually the main reason why some pap smears come back abnormal. HPV infects the cells on the surface of the cervix, especially the squamous cells. When these cells are infected, they can change in ways that the pap smear can detect. These changes are called cervical dysplasia, which can be mild or more serious. The results are often categorized as low-grade or high-grade abnormalities. Low-grade changes, known as low-grade squamous intraepithelial lesions, or LSIL, usually indicate mild cell changes. High-grade lesions, called high-grade squamous intraepithelial lesions, or HSIL, suggest more serious cell alterations that could potentially develop into cancer if not treated. Both low-risk and high-risk types of HPV can cause these cell changes. Low-risk types are less likely to lead to cancer, but high-risk types are strongly linked to the development of cervical cancer over time. It's important to note that a pap smear itself does not specifically test for HPV. Instead, it looks for abnormal cells on the cervix. However, HPV testing can be done alongside the pap smear to check for the presence of high-risk HPV types. If a woman has an abnormal pap result and tests positive for high-risk HPV, her healthcare provider might recommend further tests like a colposcopy. This procedure allows the doctor to look closely at the cervix and take tissue samples if needed. If the HPV test is negative but the pap smear shows mild abnormalities, the follow-up might be less aggressive. Sometimes, these changes are caused by other factors like infections or hormonal shifts. Persistent infection with high-risk HPV types is the key concern because it can, over time, lead to cervical cancer if abnormal cells are not identified and treated early. Thanks to the introduction of HPV vaccines and combined screening methods, early detection and prevention have improved significantly. These programs help identify women at risk sooner, reducing the chances of developing cervical cancer. In summary, HPV influences pap smear results because the virus causes changes in cervical cells that the smear detects. The presence of high-risk HPV types increases the chance that abnormal results could be precancerous. That's why combining pap smears with HPV testing is so effective in screening for cervical cancer. It helps catch potential problems early and guides appropriate follow-up care. Always remember to consult your healthcare provider for personalized advice and regular screenings, as early detection is key to maintaining cervical health.